Hey, it's Judas. What's up? Yes, my hair is very different. I've got this, there's a lot happening with it. I also had it styled differently earlier, but yes, hair is different. Take it in. I needed something a little more fun and also a little less femme for now. How are you? If you're wondering what my shirt says, it says, I used to like teddy bears. Now I just like bears. That's a lie. I also still like teddy bears. But yes, I saw it on TeePublic and had to get it. So, ta-da! I am 1 month on tea. Technically 2 days shy, but I don't think anything's gonna happen and I look nice right now. So, let's just talk about it because I think today is the only day this week I'll really have time to do it. First off, if you've arrived to tell me that you don't understand why I'm transitioning because I'm so pretty as a girl, can y'all quit being so shallow? Like, I'm sorry that it's shocking to you that I care more about being happy than my appearance. And I don't know why you value my appearance so highly, but like, I don't care, so stop it. Yeah, I'm getting very bored of those comments. And that's something that people say, that particularly AFAB people, all the goddamn time, because we as a society understand now that female attractiveness is a commodity that is powerful. It can be used to influence, to manipulate, to sell things, to make money, and the fact that people are willing to give that up to be happy, I think makes other people freaked out and maybe in some cases jealous. But yeah, why would you transition? You were so pretty as a girl. Because I'm not a girl, and because I care about being happy. Thank you. Cool. 1 month. There's not a lot to write home about. But at the same time, there kind of is. So the first couple weeks, I just would have anxiety spikes kind of close to my shot, and then I would get really sleepy between day 3 and 5, and then nothing, unsurprisingly. By week 3, I started to notice that my vascularity had drastically increased. Let's see if I can get an example on here. So basically, at this point, the shape of my wrist has completely changed because of this Y vein here. Yeah, you can see it there. It's hard to show with this bright lighting, but I started to notice that my vascularity would get kind of dramatic at times, particularly with my hands, particularly if they're like far away from my body. But that was cool. I was like, okay, maybe this will help my working out a little bit. I also noticed there's like a vein that's like on the front of your ankle, like in front of the ankle bone, and that has like gotten more obvious on me, weirdly enough. Sometimes it's like depressed into my skin. It's like not sticking out. It's doing the opposite. And sometimes my wrist veins do the same, but I don't know if there's an easier way to show you this, but yeah, you can see there. That's cool. I was excited about that. And I do feel like there has been some change to my forearms, particularly. Oh yeah, you can see like I kind of have this like nice like curve to my arms that's forming, and it's pretty solid. My quads, I feel like that's something that's kind of fun. My quads are kind of insane. I don't have any problem locating them for my shot, that's for sure. Not that I did before, because it's a pretty obvious place, but I'm still really skinny and pretty small. I do want to bulk eventually, but I'll get into that. So maybe some slight muscle changes, but I've been working out very hard for 6 months, so there's not going to be any way for me to know when tea is changing that, or if it's just like, oh, I got past a plateau and this is just my own hard work, and I can't look inside of myself to see when exactly tea is changing the whole muscle thing, but hopefully it will eventually. No hair changes of any sort. And as you can tell by my voice, nothing is happening with my voice yet. But I'm still on like a half dose to start off, you know, the normal starter dose. So I also haven't really had too many issues with the whole bi-weekly thing. It doesn't seem to be bothering me much, but I still want to talk to my practitioner about why I'm on bi-weekly IM versus any sort of weekly option, just because I have heard there are some studies that might show efficacy is a little better with weekly, which makes sense to me. And I don't have an issue with intramuscular. It doesn't bother me, but I just want the most effective treatment. So finally, let's talk about some of the negatives that have happened over the month. Anxiety actually wasn't too bad. What's been a big struggle actually is digestion issues. My period caused a lot of issues, and general weight fluctuations. So let's talk about that. We're going to get into some body image stuff, and it's important to know that I have been in and out of eating disorder recovery for years, and I've actually been in a treatment facility for it. So body image is a difficult thing for me, and weight is a difficult thing for me. So so my week 3 on T, my second shot day, I had my shot on a Monday, because my shot day is Monday, and I started my period that Tuesday, and it was rough. I have really light, easy periods. I was not feeling okay, and I was very nauseous and very dizzy, and like I said, I normally have very, very easy periods. This was not an easy period. I did not feel good. I had to really be careful with myself. I actually got kind of faint at one point, and I was like, this is freaking weird. I'm never like that. It wasn't a longer period than normal. It was a little heavier though, and just my physical symptoms were just weird. And I figured it was just because of the spike in testosterone, plus also having a period was just a lot for my body to deal with. So I was just patient with myself, and I was okay. But I had the most severe bloating that I think I've ever had, and that's coming from someone who's dealt with gastroparesis from anorexia. And which gastroparesis is when your digestive system just pretty much stops because you aren't eating enough. It can also be like a medical complication from other things, but typically in the eating disorder world, it's a side effect of restriction. It felt like my stomach was full of so much air and water retention that it was going to split through my abdomen. It was so painful. And of course it was distressing for my body image, but at the end of the day, the worst part was that it was so painful and it made it so difficult to continue eating. I think any other person just wouldn't have, but I'm very dedicated to my recovery and trying to build muscle and stuff. And at one point I ate my lunch, which I normally eat a slightly lighter lunch and then a bigger dinner. So it's not even like a crazy amount of food. I was like spitting it back up into my mouth and like throwing up a little bit in my mouth. I know it's gross because I was just so bloated and just things were not doing what they should be doing. But I think part of this is like I've also been experimenting with my diet a lot and trying to pack in protein, and I eat a ton of fiber, but I think a couple of the options I've tried have just not worked with my body. So I think that also messed with it. I've noticed in general my stomach seems more sensitive than it was before because I actually normally have like a stomach of steel. But I've run into a couple issues where I'm like, this never used to give me problems, but I'm feeling it right now. It's not a big deal though. Oops, LOL, I forgot to talk about bottom growth. So by week 3, I was like, I just went to shower one morning and I was like, ow. And I was like, wait, ow. And got really excited because I was like, I'm pretty sure that's going to be the start. And yes, that's been a thing that's been happening. It's just in the beginning stages. I can tell a difference. I don't know if anyone else could. Unless I'm aroused. I think there is a pretty noticeable difference if I'm aroused. But it's literally just starting now. And it's not something that personally I had any issue with. And it's something I looked forward to. Like, I don't know if I mentioned this in my other video, but the only side effect of tea that I'm scared of, besides obviously like weight gain and stuff, but I'm trying to work through that, is like really severe male pattern baldness. And even then it's like, it's worth it to me personally. Bottom growth is definitely not, so I know some like younger non-binary people and stuff are like, I don't know about that. yeah, it's definitely something that I wanted and that I'm excited about. So that has been happening. Because of my anatomy already, it hasn't really like changed the way that I clean myself or anything in general really yet, but I'm enjoying it. And it hasn't even really started to like super affect what underwear I can wear. I definitely have a preference for something that's a little roomier, but it's not required yet. I have noticed like jeans though. Jeans are a little more difficult because that seam. Ooh, that seam. My arousal like kicked up for a little bit during like week 3 to 4, and now it's kind of not there again. Come on, testosterone, make me feel like myself again. But I think I have a lot of like emotional stuff I need to work through about like reclaiming my body and self-worth and like blah blah blah, you know, stuff and things to do with all that kind of stuff. But yes, bottom growth is happening. I'm excited about it. It's only just started, you know. That's what I can say about most of what's going on. It's just starting. I'm excited, but boy howdy, I do want time to go by faster. Okay, bye. The water retention and the weight fluctuations. My hips are now bigger than when I started, and my chest is also slightly bigger than when I started. Now, I think a lot of it is water retention because it seems to fluctuate pretty drastically according to my sleep, my stress levels, my water intake, which is so weird because like it's normal for my abdomen to do that, but it seems like the rest of my body is too. So I don't know what's happening, but I was really struggling with my hips especially. I had to order some large size men's boxers despite being 5'5" and not very big. I'm wearing men's large boxers right now because of the size of my hips. So, and of course you've seen my waist. I have a very small, tiny waist. So any thickness to my hips looks more dramatic because I have kind of a narrow rib cage and a very narrow waist. So it wouldn't bother me as much if, one, I had anything else to show from T, like a voice drop or something, and also if my waist just wasn't so small. So even if I don't win the, you know, weight redistribution lottery as things go, I'm just hoping that at least my waist gets a little bigger, and it should. But also I'm every single day I'm just working on my body image and being like, it's okay if you're a dude with big hips. Like, I think other trans guys who retain a lot of their hip flesh are really attractive, and I will learn to love myself eventually. It's just, at the end of the day, I think there's a very big reason I developed an eating disorder when I first started growing into my hips finally, and not being able to wear like the smallest Hot Topic sizes of jeans. So working through many years of panicking every time because even just at a slightly more normal weight range, where does my weight go first? My hips and my face. And it's hard, but I really do feel like I'm leaving my eating disorder behind forever, and it's going to throw a fit, and it's going to try to creep back in, and it's definitely been trying to creep back in with these like weight fluctuations and water weight going all over the place. And the fact that I'm ready to let go of it and that I feel a lot happier, I have not felt suicidal once since I have started this journey, other than an experience I had with my family, which I got over. It's fine. I feel so content that it's easier to enjoy food now. So I have gained a little bit of weight, and that's a good thing, but it's not going to go to the right places yet, and it might never go to all the right places. It should shift around a little bit, but it's not going to be perfect, and there's just a lot of work I'm having to do with my body image. And luckily, when I've kind of like had little freakouts about this, there's been a lot of trans guys who've come forward and been like, dude, the same thing happened to me. Like, my body shape actually went more feminine before it went more masculine, and you know, this has happened to a lot of people that I've known. Try to just be patient. I know it's uncomfortable, but try to give yourself time, yada yada. So I will continue to monitor my comments and always delete annoying ones. So have fun wasting your tippy-typey fingers just for your comment to disappear if you're gonna say some dumb crap. But if you were curious, this is really what my first month was like. All there is to write home about was, you know, some anxiety, definitely increased vascularity, particularly after I've worked out. My hands look crazy. I'll try to insert some pictures. It's cool, honestly. Some weight gain, some muscle growth, but I don't know you know, if testosterone is affecting that yet. And nothing to write home about when it comes to hair in general. My hairline hasn't changed. As you can see, it's still very low. Still have a ridiculous amount of hair. So nothing happening a whole lot yet, but also just wanted to insert some like comfort and positivity of like, your body's going to change a lot and it's probably not going to change how you want it to at first. And let's just try to be patient with ourselves and remember that food is fuel. And if you've also struggled with an eating disorder and you are choosing to transition, I'm so proud of you. There's a reason why it took a long time for me to get the guts to, and we are very strong and we're gonna make it. So much love to you. Have an amazing day.